And what do we do when we feel like that?
Make a TikTok.
No, never mind. You know, over the past few episodes, we've done a lot of learning. Now it's time for some listening. We asked some people curious about BOTOX Cosmetic to call in with questions and hesitations that we can clear up. First is Hunter.
I always thought BOTOX Cosmetic was something people got later in life, like when they're 30-something. But I'm 21 and I'm starting to see some lines. Could I be a candidate?
First of all, ouch. Second, it's a common misconception that BOTOX Cosmetic is only for people of a certain age. Anyone 18 and over who wants to temporarily improve the look of their moderate to severe frown lines, forehead lines, crow's feet, or vertical bands connecting the neck and jaw can be considered a candidate.
In fact, many of my patients are in their early 20s or started seeing me when they were.
The best way to know if it's right for you is to book a consultation. That's where your licensed specialist will listen to your concerns before doing a customized analysis. From there, they'll educate you on your treatment options and go over the benefits and the risks. Talk to your doctor about BOTOX Cosmetic and whether it's right for you. The effects of BOTOX Cosmetic may spread hours to weeks after injection, causing serious symptoms. Once they've determined you're a candidate and consent is obtained, the treatment can usually be done the same day as your consultation.
That part is so important. Now let's hear from Jacob.
I've been thinking about booking a consultation for a while now, but I always back out because I'm worried I'll end up looking overdone. How can I know I'll like how I look after?
I get this question from first-timers a lot. One way to ease that concern is by finding a licensed specialist at BOTOXcosmetic.com. That's where you'll find medical professionals that may deliver the results that you're looking for. There's even before and after galleries of real patients to see for yourself.
I always encourage people to look through a provider's social media too, the same way you might if you were trying to find a hairstylist or a makeup artist. You gotta vet the goods before you book.
Let's hear from Jasmine.
You know, I've seen a lot of talk on social media about units of dosage. Tell me, who or what determines that? Can I ask for a specific amount?
Great question. So the FDA-approved amounts are 20 units each for frown lines and forehead lines, 24 units for the crow's feet, 26, 31, or 36 units for vertical bands connecting the neck and jaw. You'll want to talk to your provider about receiving the FDA-approved dose.
Think we have time for one more?
Let's do it.
Hi, I'm Claire. I'm terrified of needles, but I'm bothered by my moderate to severe lines, so I want to book a consultation. Does it hurt? Can I close my eyes? Can I bring a friend to hold my hand?
So it's true, we do use a fine needle to inject into the targeted muscles, but you and I have been doing this for a long time and have seen a lot of patients. Most end up saying it feels like a pinch, right?
Absolutely. I think most people are surprised at how quick treatment really is. About 10 to 15 minutes and you're done.
But if you want to bring a friend for moral support, maybe just check with your provider first.
Wow, talking really does help. I feel much better.
Well, I feel better knowing we could answer people's questions and concerns surrounding BOTOX Cosmetic. As for you, I think we might need another session. We have a special crossover episode with Juvederm. Make sure you're subscribed so you don't miss it.
Talk to your doctor about BOTOX Cosmetic and whether it's right for you. The effects of BOTOX Cosmetic may spread hours to weeks after injection, causing serious symptoms.
For more important safety information and to find a licensed specialist, visit juvederm.com.